I'm Olivia Phillips and I'm the digital editor of graziaami.com. So I chose Dr. Khan based on a personal recommendation, which I think is so important. Obviously, when it comes to your face, you want to know that it's somebody that you can really trust. I think that he doesn't go by the name the King of Botox for no reason. He's obviously got decades and decades of experience. I think the thing with things like injectables is you generally want to look like yourself just a little bit better. So I'm hoping that he's going to maybe make me look a little bit more bright-eyed and bushy-tailed, hopefully kind of reduce my under-eye bags a little bit, and also just maybe a little bit of definition. I think that generally with the region and the kind of hard living, I think a lot of people can be a little bit sleep deprived and you can neglect your skincare a little bit, so hopefully he can just like tweak a few things and put things back where they're meant to be.
Hello everybody. This is Olivia, model for the day. She's 35 years young and essentially I've seen her before about a year and a half ago, first time. We had done a few things and we start with obviously the dynamic movement. So she had quite a lot of dynamic movement, both in the frown as well as in the forehead. If you lift now, you can see basically she had some Botox around 12 days ago, so all of these have resolved. Is that right, Olivia? You had a fair amount of movement. The makeup used to actually go and embed itself into the horizontal ring.
Sadly, yes.
That's okay, and also around your eyes there was a lot of movement.
Yeah.
The chin was also quite mobile, so if we try to move the chin, it's quite now stable. We put a couple of shots of Botox in the chin because it used to dimple quite a lot. Previously we had also done some volume on her nose because she had had a previous rhinoplasty that she wasn't very happy with. So you can tell us a little bit about it? No, no. Right. And
to clarify that.
And essentially, thank you. Essentially what we did was basically, we found, if I remember correctly, it was a bit thin on top and a little crooked.
Yes, definitely.
So we did that filling for her 2 years ago and it's still pretty much lasting. I think the nose still looks pretty nice. The only thing I noticed is that perhaps it's a little bit low right here on the dorsum, so we can put some volume there, and perhaps over the left upper lateral cartilage is a little small depression. I don't know if you noticed that ever. Do you ever notice? You do?
Well,
okay.
I'm like that.
Okay, fine. So we have, obviously a very detailed patient. And the other thing she mentioned to me, can you smile again, is that she feels that she gets a couple of ridges here while smiling. Now, we haven't actually put filler here, relax my dear, but we did put some skin boosters around the eye previously. She tells me she's always had these mimic lines. Go ahead my dear, with these little sort of ridges you always had. It's possible, smile please, to put a little bit of volume here in this area and a little bit above to try and give a little lift. That might make it better and we will try to do that. The other things we notice about Olivia's face, even though she has a youthful face, is that there is a little bit of depression in the pre-jowl sulcus, which we filled last time for you. I think it was 2 years ago, correct?
Yeah.
Or a year and a half.
Year and a half.
And this area, so that area, describe what you felt when you had that filler there. I mean, how did you feel the face changed? Or did you feel anything at all?
No, I completely did, and I think it was more when I saw before and after pictures that it was like so extreme. It completely changed the entire look of my face. I know you were talking about triangulation.
Triangulation, and also a little Botox into the right masseter muscle. We noticed that she has hypertrophy of the right side. You grind on, or we asked the question before. You don't grind. You just.
No, this is your theory, but no.
No. Okay.
I don't. I've just got like crazy strong muscles. I don't know why. I don't know why.
Okay, but last time we had put some Botox in this masseter and it shrunk a bit.
Yeah, absolutely. Which is it's a big concern of mine. Like I feel like my face naturally is very asymmetric. I know everyone's is, but obviously the ideal is to not have that. So if you can do something to sort that, then that's
okay.
Great.
All right. Well, you're a little more critical of yourself than you should be, but all right. I think we all are to an extent. So we put some Botox into that masseter muscle. That was 10 days, 12 days ago. That will take a couple of weeks to kick in. And then after 8 weeks, if you want it smaller, we can put some more for you.
Yeah.
All right, so we will start by, did you want to say that?
I was going to ask you something.
Sure.
But it's something that I know, I think that it might be, obviously there's pros and cons to everything. So when I've had Botox injected here, it's made my overall face shape look more symmetrical and better, but then my smile's changed.
Right, okay.
So is that what is there that you
Smile, please. When you say it changed, you mean it doesn't lift as much on that side?
Precisely.
I think probably, did this happen last time as well?
I think so, but I can't remember if I'm honest.
Normally, smile please, I think the reason for that will be more likely to be something to do with the Botox in the chin,
Okay.
rather than in here. Because from here it tends less likely to move. But I mean, I think what we need to do is smile please. It tends to lift more your smile on one side than the other.
Anyway, like naturally.
Is that naturally the case usually with you?
I don't know if I've noticed, to be honest.
Because usually there are muscles that lift the mouth corner, and it is possible for Botox to move when you're injecting the nose, particularly, or sometimes for gummy smile, it's possible that the levator muscles or muscles that lift the mouth corner can be inadvertently paralyzed by a little movement, just like you can get a droopy eyelid from injections here. From here, it's less likely because they are all going this way and it's a little bit far. But from the chin, can you show me your teeth? Yeah, you know, this is fine. It's only this part that doesn't move up. Now, if that happens naturally, then obviously, but the answer is it should not affect.
Got it.
But we can check this, say, in about 6 to 8 weeks' time and still see if it's still there. All right, so let's get on with the treatment.
Saying something else in like 20 minutes, but it always surprises me how unpainful it is.
Oh, good. Now, you see, there's two things that happen when I do this. I haven't been able to take it away completely, but I don't want to give you a filler face, so because you're still relatively young. But I want to show you that, look at your face now, we will bring this up a little bit more and it'll look better and better. But smile, but that second part is better. You don't have a depression as much there. This one was less than this one anyway.
Yeah.
But relax. But I think by lifting this up, we'll make it a little bit better.
So just, what is it? Is it muscles? Is it skin? Like, why does it happen?
There are so many variations in human anatomy that I can't really picture why. I agree with you. It looks like filler.
Great.
but you see, I think it's better. I think it's better. Relax again. Once again. Relax again. All right, let's try the skin boosters now.
Can I ask you a personal question?
Yep.
Do you have filler?
No, never had it.
You never had it?
No.
Aren't you intrigued to see what it's like?
Yeah, no, I want to do it. I know where I want to do it. I just have to find somebody I trust enough to do it
you
for
wouldn't
me.
do it yourself.
Smile, please. No, I wouldn't do it to you. It becomes logistically quite difficult and ergonomically quite difficult. Big smile again. Big smile. Okay. Relax. Thanks. Yeah. So that is improving. Okay. Close your eyes again gently. This is the last one. I think though you will notice overall, smile please, that you only have now just that one. That one is practically gone.
Yeah.
That one is better here, but not so good here. I wonder by putting filler here whether that would make a difference, but I think I'm scared to do that because I think you might look a bit overfilled.
Yeah, that's
that's not the right thing to do. So we'll put a little bit here now.
Okay.
Okay, so we're going to now focus a little bit on the jawline here and then just do a little bit here. So if we look and focus, we can see that this area is the area that we really need to focus on. I'm going to put a little bit on the jawline here. altogether it's coming up, right?
Yeah.
I mean, you're basically here, and
I just look so much like plumper.
it's fresher.
and-
Yeah, it's like you gained a little weight, but you haven't. Your body hasn't, but your face has.
Which is
Which is
ideal.
what we want. So let's talk through this, because all I'm seeing is a little depression here and irregularity, and that's it. But I can put a tiny bit in here too.
That would be good.
Okay, well, that's all. Let's do it.
Where do most people request filler?
Sorry?
Where do most people request?
Most people, well, it's a question. Nowadays, what I find is most people don't know what to request.
Uh-huh.
And they ask for something when it is not really required. And so it could be any amount of places. But most commonly, I think it's the lips. Now I'll just put a little bit in here, and there's not a lot more to do in your nose. I don't want to put huge amounts because they make it thicker. You understand?
Yeah.
So it's a bit swollen on that side. I use only one entry point to prevent bruising, and now I'm going to put a tiny bit here. Okay, just
Oh my god.
nice, huh?
Yeah. It's amazing. So
Good.
good.
Okay, fine. Let's do that. So we're going to hold a little pressure here, if you don't mind, Larry, just like this along the nose, so that, because you know these entry points get swollen, so you can't really see. So it'll swell up again, and then it'll go down again, and I think it looks pretty much like an unoperated nose now.
It literally looks like the nose that I was meant to have.
Well, you have it. There you go.
No, but
Okay.
I can't believe it's such a small amount. It's made such a massive difference.
It does. It does if it's if you have small issues. Well, before it was a bigger volume
Right.
because there was more irregularity. Now those are, and the interesting part is that look at it's been 1.5 years,
Yeah.
right? And it was like July, I think, 2017 we did this,
well,
right?
August, yeah.
Yeah. So, you know, almost coming up to 2 years, and we used 25% of the volume we used the first time. For pretty much the same result, I think. So I think interestingly, you might find it staying longer and longer. Each time we inject, we create bleeding inside and some trauma, and that trauma leads to fibrosis and possibly more scar tissue. That's the theory I have anyway. So then there's scar tissue being laid down, and that scar tissue is pretty permanent.
So you're effectively building it from the inside out.
I think so, because we know that putting for example, skin boosters into the dermis of the skin will stimulate collagen. So we think that perhaps by putting it at a depth, even by fibrosis or collagen formation, or indirectly or directly, that there's got to be something, because I'm finding I use less and it lasts longer. So it's great.
It's really good. It's good for me. That's amazing. Oh, thank you.
All right, my dear.
I'm over the moon. Thank
Fantastic, fantastic. All right, so you see, this part is the only part that is still a little bit of an enigma for me. I don't understand why. Smile, please, but it may be possible to put some filler here. Relax, thank you. But I'd rather everything settle down. I can see what it is, and then we can tackle it later.